You and I speak this afternoon, South Africa has 116 confirmed cases of the COVID-19 coronavirus. With the virus already having claimed more than 8,000 lives globally, it's now being compared in some quarters to the Spanish flu, which broke out in 1918 and killed no less than 50 million people around the world, we are told, but 300,000 people in about 6 weeks in this country. UCT history professor emeritus Howard Phillips joins me now via Skype to discuss how we can avoid the same impact in this country. Prof, thank you so much for this conversation. You penned an opinion piece about how South Africa can avoid the mistakes that were made in responding to the Spanish flu in 1918. Before we get to those mistakes, talk to me about why you've been so fascinated with the topic of the Spanish flu. From what I've been tracking, you've been writing about it since at least the 80s, the early 80s, that is.
Yeah, Tulasi's where I stumbled upon this topic years and years ago, and I was astonished that a disaster of that magnitude should not have found its way into the history books. There was no mention of it at all. And a country doesn't lose 6% of its population in 6 weeks and things go on as before. So I began to investigate, and what I discovered is, though the history book said nothing about it, a lot of people who had lived through it still survived and had very clear and indeed vivid memories. And so I began to do lots of interviews with people who had lived through that, and that gave me a very, very deep understanding of the magnitude of that catastrophe. And ever since then, it has been something which I have looked at, because every virologist has said it will come again. It's not a matter of if, it's a matter of when. And indeed, there have been several scares, and it looks as if coronavirus may well be something of the same sort, though should it never be of that magnitude. 50 million, 100 million people around the world would be a catastrophe, a cataclysm.
Yeah, absolutely. So, as you draw those parallels with the benefit of the work that you've done on the Spanish flu and the direct access of people who still survived when you were doing some of your research and now living through these moments of coronavirus, what are the parallels that you are drawing there? And hopefully, as you say, it doesn't become as deadly as the Spanish flu was.
I think, to a large extent, where the parallels are what not to do. Because in 1918, they quite simply didn't know what hit them. They didn't know what caused influenza, which is something very different to today. We know exactly the nature of the coronavirus. And consequently, they were hard put to get their heads round the nature of the catastrophe which was engulfing them. And so quarantine and isolation, they were very slow to implement. And that's one of the points which I made in that opinion piece last week, when it seems a long time ago, we were still discussing should the South Africans in Wuhan be repatriated or not. The point I made then was that the lesson of 1918 is that you should quarantine very strictly indeed. They had not done that in 1918, and consequently the influenza had spread, in the words of one magazine at the time, like quicksilver, spreading around the whole of the country, bringing the deadly influenza to the most remote and most distant parts of the country, where it absolutely wreaked havoc.
So there's a bit of a discussion then, Prof, about whether or not in some of the measures that President Cyril Ramaphosa announced in announcing a national state of disaster, whether those are adequate or whether they are an overreaction. So such measures as restricting the number of people in a gathering to under 100, but also restricting travel to certain countries that are deemed to be high risk, and also discouraging unnecessary domestic travel and only essential travel being allowed. When you then compare what should have been done in 1918 but wasn't done, leading to the spread, and you compare it with what has been done now, what's your sense?
My sense is that on paper, what has been announced now makes very good sense. What we need to be vigilant about is that what is announced is actually implemented, that the quarantine measures are imposed, are effectively imposed, that the restriction on large gatherings is indeed implemented. I was trying to think around, we've heard about gatherings of no more than 100 people being permitted. 100 people is a lot of people. And indeed, if you begin to think about places like prisons, places like factories, places like the Army and Navy, those are clusters of people in close proximity to one another. And one needs to, if you're going to effectively try and contain the coronavirus now, you need to be strict now. You know, the old Roman motto is, the health of the population is the supreme law. And indeed, it's better to err on the side of caution now than regret and be sorry 4 weeks down the line when you would perhaps say, oh, we should have implemented more strictly.
All right, Prof, thank you so much for your time. Unfortunately, the line is not so great. I would have wanted to keep you a bit longer and actually have this conversation properly, because you've been working on this subject for quite a period of time. That's Professor Howard Phillips from the University of Cape Town there, talking to us about the parallels and the lessons to be learned from the Spanish flu of 1918. In fact, South Africa was one of the 5 countries that were worst affected by that flu. So the Prof there insisting we should be drawing lessons in responding to COVID-19.